This is a CNA podcast.
This is Work It with Cheryl and Stanley Leong. In collaboration with Leong Foundation, Care Corner Singapore is initiating a new approach to funding the social services sector as they move towards developing a future-directed social service agency and encouraging innovation in social services.
So today on Work It, we want to see how that's working out and what Care Corner Singapore seeks to achieve through this new approach. So we're also taking a closer look at how different social innovation is in the social service sector as compared to the commercial sector. So we speak now to Christian Chao, Chief Executive Officer of Care Corner Singapore.
That's right, Care Corner Singapore or CCS. They're a non-profit organization providing social and healthcare services to build hope and promote well-being for those in need. And they include children with special learning needs or from disadvantaged backgrounds, youths at risk, troubled families, vulnerable seniors, and individuals with counseling and mental health needs. Christian, thank you for joining us on Work It. Welcome to our program.
Thank you, Stan and Cheryl. Glad to be on the show.
Now, Christian, we understand you've spent about 4 years now with Care Corner, presumably your first time nestled in the social service sector. And prior to that, we understand you'd been Senior VP for Strategic HR at UOB, and you were also with the Civil Service College as Director of the Institute of Leadership and Organisation Development. So tell us how you've been able to tap on those professional experiences and expertise networks prior to this, and bringing about change over at CCS, introducing a culture that also empowers this sector.
Well, again, thanks, Cheryl and Stan. I think the past experiences that I've had in different sectors, whether it's the public sector and then in the private for-profit sector, has been very useful in the journey that I've been on right now in Care Corner in the non-profit sector. I think in all sectors, there are some common areas of need. For example, I think we all seek to deliver services that meets the needs of our stakeholder, the people that we're trying to serve. And at the same time, there's always this continual need to adapt, to innovate in order to address evolving and emerging needs. And in order to do so, I think it's important to ensure that we have the right people, the right capabilities, and a conducive culture in order to deliver all of these needs. And I think the experience I've had in organization development, when we look at issues, we try to go beyond just looking at it from the symptom, but really trying to adopt a more system lens, trying to see that there are a lot of interconnected parts to an issue. And if we are going to develop sustained impact and change, we then need to ensure that we understand, what those issues are, and then learn to adapt, and then innovate and ensure there are proper, change practices in order to meet those needs.
And Christian, for the social service sector, funding is always critical for agencies to keep on providing their services so that they can serve the underprivileged groups in society. Can you tell us what kind of investment or giving would make the most impact for charities and the social service sector? And how can corporate giving also become a bit more meaningful to charities?
So Cheryl, I think, one of the things that I've noticed in Singapore is that we've got really, really generous, individuals, both who have donated and some have donated quite sacrificially, as well as very enlightened corporates that are increasingly seeing the need to be more corporately and socially responsible, in the way they channel resources, whether it's, donations as well as, volunteers. At the same time, I think most giving at present tends to focus on addressing what I call remedial work, and that is trying to address the beneficiaries' more immediate pressing needs. It also tends to be a bit more short-term, and then focus on funding a particular program. Where I think would be increasingly helpful, is especially for philanthropy, and corporate donors to start thinking about giving in areas of work where it's a bit more preventive. So rather than wait until, you're facing a particular issue, how can we start going upstream and trying to address issues at the roots? And then how do we fund those types of work? So the preventive developmental work. And at the same time, I think when we think about giving, it's important to note that in order to achieve impact, it sometimes does take time, right? It might take more than a year. Sometimes, often, it takes 2 to 3 years. So, if we are able to also give with a longer time horizon, so that the work that we're trying to do can really, have that sustained impact, I think that will make a big difference. So, I think this is where philanthropy can really make a difference, because a lot of the issues that we're now facing are complex. So, it's not just easy to address it with short-term funding and programs. So really, we need to provide a longer term funding and address more the systemic issues that the families are facing.
Yeah, it sounds similar to how a government is trying to look at the aging population and trying to ensure that we live as healthily as we can before all the ailments set in our later years. So more preventive rather than reactive. You talk
Exactly.
about preventive development work. Are there concrete examples perhaps that you could lend maybe through the CCS lens as to how that might work or how that might look if we were to be doing that, or if an organization wants to be involved and help stem the problem from earlier on?
Yes. So I think some of the things that we have been doing, and we did this together with our partner, Leong Foundation, in a previous project, where we paid a lot of attention to early childhood development work. We recognize that sometimes the issues that we see families face later on is because their own early developmental years they were not given the opportunities for them to acquire certain capabilities, for example, executive functioning capabilities. Now, if we are able to reach children much younger, help them in their growing phase, help them acquire some of these developmental capabilities, right, or meet those developmental milestones, we actually are able to really stem, them from more complex social issues from taking place later on. And this is where we think that more work needs to be given more attention to some of this early intervention work that we are not having to address. Yeah.
So it'll, I guess, funnel less, children as they grow up into the youth at risk category and the basket as well.
Exactly. So we want to be able to reach children, help them grow, into they have a much more positive, I guess, developmental experience in the younger age, so that we prevent them from becoming, youth at risk later on.
Yeah. Christian, we also read that, the building of a core innovation engine for Care Corner involves a new team of talent with capabilities typically found outside of social service, such as design, technology, and also product management. Can we first discuss what exactly social innovation is, and then how is it different from innovation in the commercial sector?
Okay, so when we think about social innovation, what we're trying to do is to be able to have programs and services that address some of these complex social, issues. For example, one of the issues that we're trying to address is intergenerational social mobility. How do we help families that are currently, in a low income bracket? How do we ensure that their children, will do better in life? Do better than where the parents is right now. And these issues are actually quite complex. And when we start thinking about how that compares with, let's say, innovation, in a commercial sense, I think there are two key differences that are being experienced by non-profit social service agencies. I think the first is the incentive to innovate. What do I mean by this? I think, when we look at innovation in a corporate setting, the consumer of the service that is being provided is actually the party that pays for that service. So when a service or innovation is well received, actually that results in revenue and profits, and those resources can be channeled to delivering more services and innovating even more. And then there's a clear virtuous cycle. But in the social service sector, this is actually quite different, because the consumer of the service is actually not the party that pays for that service. That service is actually paid for by a donor, a funder, right? And so when innovation is actually well received, it doesn't always automatically result in more resources, right? And in addition, the benefits of a social service isn't always immediately felt. some of these effects and benefits might require some time for us to experience it. So this is one of the key difference. I think the other one that I want to quickly highlight is, I think the social sector, what I've come to really appreciate is that there is also a reliance on very lean and limited resources. So unlike most, for-profit organizations that have a bit more, I would say, buffer, a bit more resources to invest in things like innovation, I think for non-profits, that is really a luxury. And that is in part because most donors and funders would want their donations to be channeled directly to beneficiaries and to the programs. And there are not enough funders who are willing to invest in developing the innovative capabilities of a social service agency. And I think this is something that I really, really do appreciate, very enlightened, progressive funders like Leong Foundation who sees the need in investing in developing innovative capabilities and not just funding the programs in order for more sustained impact to take place in the sector.
And earlier on, when Cheryl was asking about the new team of talents, they straddle design, technology, product management. So who are these people? Where do they come from?
So I'm glad to share that at Care Corner we've been really fortunate to be able to attract good talent from, in fact, the sectors outside the social services sector. So I have a teammate right now who leads our design work, and actually she comes from public service, right? And she's been doing design and strategy work for more than 10 years in one of the statutory boards, and so she comes with this wealth of experience. And what has drawn her into the social service sector is the opportunity to apply all these skills and experience for social impact, and to be able to see that impact made more tangibly, as she engages the communities and families and trying to see how can design improve the experience of those services, and of course that with the expectation that will deliver a much bigger impact to the lives of the families that we're trying to serve.
Okay, and Christian, so nothing really stays static when you're talking about people, their lives, and their livelihood in general. What are some of the notable changes you've seen in community needs, and have they perhaps become a bit more complex nowadays?
Yes, I think when we think about social services, even now, I think sometimes we think of social services as making sure that people are not hungry, they are not lonely, and that we just make sure that they are taken care of, make sure there's money, there's food, things like that. But as we start looking at Singapore increasingly becoming developed, I think our concerns are now not just about basic things like food. I think we are more concerned about the question around how do we make sure that the next generation do much better than the current one, so that they're not still found in situations where they're vulnerable. For example, still in the low income group. So and this issue is actually quite complex because it is not just about making sure that they have a good education, and making sure that they have sufficient finances. But there are a lot of underlying issues that still needs to be addressed. How do we ensure that the families can stay, financially can be more financially independent, and not just rely on donors and government giving them financial assistance, but how can they develop the capacity, right, to become more independent themselves? And I think that's the challenge that we're having to deal with in Singapore right now. Yeah.
Yeah, and not just for the here and now, like you say, it's going to be a legacy that you'd like to also change, I suppose, for some of these individuals and their households as well. Are there any other headwinds you foresee for the social service sector that you are also, bracing your team for in encountering in the months, years ahead? And also maybe just leave us with a message as to how other quarters of society, whether it's public or private or even individual people sectors, can step forward to be part of this cause at Care Corner.
Yes. I think one of the headwinds, of course, is always the constant pressure in making sure that the resources that were given is being channeled, with impact, and that there's real value, right, in the donations that we get. And the question then for all of us in the social services is, how do we continue to think about making sure that what we innovate, the things that we do, is making sustained impact, and not just addressing a short-term need, but really making sustained impact over time. And as we do this, I believe that this cannot just be the responsibility of social service agencies, or for that matter, social workers. I think it really requires the community to come together. And that's why I'm very heartened that, increasingly there's this recognition that, corporates also play a very big part in supporting this effort, not just in the funds that they support agencies with, but even in terms of like the skills that they're able to contribute. So a lot of the skills that they have, whether it's technology skills, design skills, actually these are skills that can be really useful for agencies. The other thing is really the community involvement in terms of, just coming and volunteering, being involved, being aware of what's going on in the community, being invested, in caring for one another in the community. And I think with that, I think we'll go a long way, and, that will really strengthen the social compact, that we all, want to see here in Singapore. Yeah.
Truly a collective effort that's needed. Now, if you would like to get to know more about the services of Care Corner services, how you or your organization can render support towards the causes that they offer, the services, do visit their website. That's www.carecorner.org.sg. We have been hearing from Chief Executive Officer of Care Corner Singapore, CCS. Christian Chao has been our guest on Work It here on CNA 928. Thank you so much, Christian. All the best.